Hey everyone, welcome to my channel The Good Doctor. Today we are going to talk about pulp necrosis. Pulp necrosis, are also called as pulp death, is a condition following untreated pulpitis, meaning when there is pulpitis in a tooth but it is not treated, it can lead to pulp necrosis or death of pulp tissue. The pulpal tissue becomes dead, and if the condition is not treated, noxious material can leak from pulp space to the periradicular tissue, forming the lesion of endodontic origin. So in simple word, we can say that if the tooth has pulpitis but it is not treated, it can lead to pulp necrosis. And if even the pulp necrosis is not treated, it can lead to periradicular lesion of endodontic origin. Necrosis may be partial or total, depending on the extent of pulp tissue involvement. Mean, if small area of pulp is involved, then there will be partial necrosis. But if the major or all area of pulp is involved, it is total necrosis. The pulp necrosis can be classified into two types depending on types of necrosis: coagulation necrosis and liquefaction necrosis. Coagulation necrosis. Coagulation necrosis, the protoplasm of all cells becomes fixed and opaque. Cell mass is recognizable histologically. Intracellular details are lost, meaning there are no changes microscopically, but when we see on electron microscope that there are intracellular details that are lost. There are no intracellular details on electron microscope, but on simple microscope everything looks normal, but protoplasm of cell becomes fixed and opaque. And this is also because cell outline is not disturbed, so we can only appreciate the changes in coagulation necrosis at the time of coagulation necrosis on electron microscope. When sometimes passes, coagulation necrosis can be recognized on simple microscope. Second type of necrosis is liquefaction necrosis. In liquefaction necrosis, the entire cell outline is lost, so it can be recognized on simple microscope and on early stages. The liquefaction area is surrounded by a dense zone of polymorphonuclear leukocytes that are chronic inflammatory cells. So we can say that difference between coagulative and liquefative necrosis is that in coagulative necrosis cell outline is preserved, but in liquefative necrosis cell outline is lost. But these two types of necrosis can happen in pulp. So we can say that necrosis of pulp can be either liquefative necrosis or coagulative necrosis. Etiology, that why it happens and what are the causative factors of necrosis. Necrosis is caused by noxious insult and injuries to pulp by bacteria, trauma, and chemical irritation. So these are three things that can cause necrosis of the pulp. Symptoms of necrosis of the pulp. First, it is discoloration of tooth. That is first indication of pulp death. There is discoloration of tooth, means the color of the tooth is lost. Second is symptom is history from patient, but in some cases tooth might be asymptomatic. Diagnosis is how we can diagnose pulp necrosis, or how we can say that pulp is necrosed, is by following symptoms or following tests. First is by pain. Second is by asking about history of patient. Third is the radiographic changes. Fourth is vitality, and fifth is visual examination. These are the things by which we can confirm that there is pulp necrosis. Pain. It is absent in complete necrosis, but when there is partial necrosis, the pain may be there and the pain is very severe. But when there is complete necrosis, the pain is absent. History of patient reveals past trauma or past history of severe pain, which may lasted for some time, followed by complete and sudden cessation of pain. Radiographic changes can be appreciated in case of pulp necrosis. Radiographs shows a large cavity or restoration or normal appearance, unless there is concomitant apical periodontitis or condensing osteitis. Number fourth way on which we can confirm the tooth pulp necrosis is by vitality test. Tooth is non-responding to vitality test means it most probably means that pulp is necrotic, but there can be false positive or false negative results. So, but vitality test so we have to consider other symptoms too. But in vitality test, tooth is non-responding. But multi-rooted teeth may show mixed response because only one canal may have necrotic tissue. That is the case of partial necrosis. When there is partial necrosis and there is multi-rooted tooth, most of the time that is in multi-rooted tooth, it can show mixed response when we test at different surfaces of tooth, depending on which root or which area is necrotic. Sometimes teeth with liquefaction necrosis may show positive response to electric test when electric current is conducted through moisture present in a tooth canal. So that can be false negative result, but still there is liquefaction necrosis, but the patient will show the response doesn't confirm that there is no pulp necrosis. So we have to consider all the symptoms together to confirm the diagnosis of pulp necrosis. Next is by visual examination. Tooth shows color change like dull or opaque appearance due to lack of normal translucency. This is because when the pulp is dead, there are organic material that get embedded in the dentine, and when they get embedded in the dentine, the color of the tooth changes to opaque appearance or dull appearance. Histopathologically, how we can confirm that there is necrosis? Necrotic pulp tissues, cellular debris and microorganisms are seen in the pulp cavity. If there is concomitant periodontal involvement, there may be presence of slight evidence of inflammation. Treatment of pulp necrosis is by complete removal of pulp followed by restoration or extraction. It depends on restorability of the tooth. If the tooth is restorable, then we go for the root canal treatment, but if the teeth is not restorable, then we go for the extraction. Don't forget to like, share, subscribe and comment. Thanks for watching.